Welcome to Open BXRx on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. Every month, we'll have a special segment here on Open BXRX where medical professionals join us to provide insights into how we can all be healthier. Welcome to the Whole Health Report, sponsored by Empire Blue Cross Blue Shield. As some of us may know, February is Heart Month. On today's Whole Health Report with Empire, we'll be talking about heart health and blood pressure specifically. We're happy to welcome back Dr. Craig Hersh, the Chief Medical Officer at Empire, and a special guest, Dr. Maday Gonzalez, an interventional cardiologist from Montefiore Medical Center. Dr. Hersh and Dr. Gonzalez, welcome. Thank you so much for joining us again.
Thank you for having us.
Thank you for having us, Sonny.
Of course. So today we are going to be discussing blood pressure. Dr. Hersh, can you please tell us a little bit about why we wanted to focus on this particular topic this month?
Sure. High blood pressure in the Bronx is a very important topic. 30% of Bronxites, adults, have high blood pressure, and that's the highest of any borough in New York. And high blood pressure is very important because it goes on to lead to heart disease. Heart disease, as many of you know, is the #1 killer of Americans and people right here in New York.
Thank you, doctor. And when we talk about high blood pressure, what is the difference between high blood pressure and hypertension?
Yeah, sometimes the terms are really interchangeable. The word high blood pressure can refer to any one time when you get your blood pressure checked. And if it's up, somebody may say your blood pressure is high. But if you have the ongoing condition of having high blood pressure most or all the time, that's called hypertension. But to be honest, everyone just calls that high blood pressure. So it can get a little confusing. Now, normal blood pressure in an adult is 120/80 or less. Once your numbers start to go higher than that, it can be elevated or considered high blood pressure or hypertension. And one of the best ways that people can determine if they have high blood pressure, if they're on the fence, they're not sure after seeing their doctor, or if you have high blood pressure and then you want to monitor it to make sure that you have good control, is using one of these ambulatory blood pressure monitors. It's a home monitor you could just put on. It's covered by Empire and other insurers. And it's really one of the better ways to know that you're having good control of your blood pressure.
Got it. Thank you, Dr. Hersh. And as we know, mortality rates are really high when it comes to high blood pressure. Why is this? Why do so many people pass away due to high blood pressure?
So high blood pressure is known as the silent killer. People who have high blood pressure usually don't have any symptoms. And if you don't have any symptoms, you don't often take any actions. And those actions include making sure you're on a diet that's low in sodium and also rich in fruits and vegetables, usually something we call the DASH diet. People may not do the exercises that they need to do. People may not visit their physicians as often as they should or take their medications, all because they're feeling relatively okay.
And Dr. Gonzalez, as an interventional cardiologist at Montefiore, you can give us a good idea of what's happening right here in our borough of the Bronx. But first, can you tell us what an interventional cardiologist does and what your role is?
Yes, thank you, Sonny. So an interventional cardiologist is a cardiologist that uses invasive and non-invasive measures to not only diagnose but also treat those diseases that affects the cardiovascular system in its entirety. Not only the heart, but the vasculature, carotids, legs, brain. So we used anywhere from lifestyle changes, counseling, to a little bit more minimally invasive procedures called cardiac catheterizations, angiograms to diagnose and treat these diseases.
Got it. And Dr. Gonzalez, just as a plus for people at home, invasive, does that mean when you're touching the heart on the inside?
No, that would be actually open heart surgery. Okay. We do it via a big IV that we put in the artery and then go with catheters up to the heart or the legs or the area in trouble.
Got it. Thank you for clearing that up. And can you please share what the most pressing heart health issues are here in the Bronx in particular?
Yeah, so hypertension has to be number one. Across the country and the world, hypertension is the number one cause of cardiovascular disease. like Dr. Hersh said, not only cardiovascular disease, but also mortality is the cause of death. Um, Here in America, 68 million people suffer from hypertension, or high blood pressure. And that is equivalent to 1 in 3 adults have hypertension. And only, this is a scary number, 20% of those people don't even know they have high blood pressure. They're walking around with high blood pressure. And like Dr. Hersh said, until something bad happens, meaning a stroke, heart attacks, kidney dysfunction, they don't know it. That's very, very scary.
That's definitely scary. And Dr. Hersh, why does hypertension go undiagnosed so often and untreated?
Well, like I said, it's a silent condition, so people don't have symptoms. The other is there's just really not enough awareness, right? Being that it's so prevalent and so dangerous, we need to focus on this. And that's why we're partnering with folks over at Montefiore and Dr. Gonzalez, and we're partnering with BronxNet, and we're partnering with the New York City Department of Health to get the word out. Because the more people know, the better the likelihood that we can help people. And as you know, and we said it last time, our mission at Empire is to materially and measurably improve the health of all New Yorkers, and blood pressure is the #1 place to start.
Absolutely. We're always glad to have you here, educating our Bronxites and, letting people know about those important factors especially when it comes to heart health this month and even beyond this month. Dr. Hersh, I read recently that COVID-19 lockdowns appear to have caused more cases of high blood pressure. Can you please share how COVID-19 and stress are related and interconnected to heart health and blood pressure?
Sure. I mean, one of the ways to control blood pressure are through some lifestyle activities. Being sedentary is bad. So for blood pressure, so people who are not able to go out and about and take regular walks or do regular exercise, or they're sitting all day, not good. Same thing with diet. You would think people are at home, they could be eating what they want, but you need to be on a proper diet to control your blood pressure. The other thing is sort of stress and alcohol, right? Those things also contribute adversely to high blood pressure. But the sort of inverse of what you were talking about, during 2020, during the time of COVID, deaths due to high blood pressure were up 40% in the Bronx. So it's because people maybe weren't getting the care that they needed and doing the things that they needed to do. It's hard.
Absolutely. And what tips or advice can you give people to address the issues of high blood pressure today, doctor?
Again, increasing awareness, seeing your physicians, doctors like Dr. Gonzalez and other doctors over at Montefiore and other facilities here in the Bronx. You can always get information. There's a couple of really good websites, montefiore.org, of course, heart.org, which is the American Heart Association website. There's information on high blood pressure. And lastly, for resources, in particular, nyc.gov.
Thank you so much, Dr. Hersh and Dr. Gonzalez, for joining us today. And we'll see you next month for another topic here on the Whole Health Report.
Thank you, Sonny.
Thank you.
Of course. Thank you both. Again, this is the Whole Health Report sponsored by Empire BlueCross BlueShield. Every month we'll have a new topic. For this month, we're specifically focusing on Heart Month. So make sure that you take care of your own heart. I know that February 14th, Valentine's Day just passed, and we like to spread the love to our family and our friends, but we also have to spread the love to ourselves and take care of our hearts as well. Thank you again, doctors. We'll be right back.